The lungs and respiratory system allows the oxygen from the air to pass through our body while also allowing the carbon dioxide from the air to be expelled. Air fills a huge fraction of the millions of alveoli with each inhalation. It is in the alveoli that oxygen and carbon dioxide exchange happen. Diffusion is the process by which oxygen travels from the alveoli to the bloodstream via the capillaries or the small blood vessels that lines the alveolar walls. The hemoglobin in the red blood cells absorbs oxygen once it enters the bloodstream. This oxygen-rich blood returns to the heart, which delivers it to the oxygen-hungry tissues throughout the body via the arteries.
Acute respiratory distress syndrome, previously called the adult respiratory distress syndrome, is a severe form of acute lung injury which happens when fluid builds up in your lungs, tiny elastic air sacs, which is also called the alveoli. When fluid starts to leak in the capillary bed, it will collect in the sac and thus decreased gas exchange will occur and the alveoli might collapse. Hypoxemia will also occur wherein the other organs might suffer as well.
Fast onset. The onset is fast and happens suddenly. The main symptom of ARDS usually develops within a few hours to a few days after the precipitating injury or infection.
Patients with ARDS are usually already hospitalized with another condition. ARDS patients may have to be put in an intensive care unit or ICU and on a ventilator to help them breathe. Most people who develop ARDS are already hospitalized for another condition and many are critically ill.
Develops due to systematic inflammation. The most common cause of ARDS is sepsis, a serious and widespread infection of the bloodstream.
High mortality rate. Many people who develop ARDS don't survive. The risk of death increases with age and severity of illness. There are people who do survive acute respiratory distress syndrome. Some recover completely, while others experience long-lasting damage to their lungs.
Severe shortness of breath, labored and unusually rapid breathing, low blood pressure, confusion and extreme tiredness. Other signs and symptoms would be low blood oxygen, clicking, bubbling, or rattling sound in the lungs when breathing.
A wide range of factors are associated with the development of ARDS, including direct or indirect injury to the lungs. Direct causes includes: number 1, pneumonia. This is an infection that inflames your lungs, air sacs, or our alveoli. Number 2, aspiration. Aspiration of stomach contents into the lungs may cause severe lung damage and ARDS. Number 3, inhalation injury. This includes breathing smoke or chemicals. Number 4, near drowning. Near drowning occurs when you're unable to breathe underwater for a significant period of time. Number 5, embolism. Embolism is the obstruction of a blood vessel by a foreign substance or a blood clot that travels through the bloodstream, lodging in a blood vessel, clogging the vessel. Number 6, chest trauma. Chest trauma is any form of physical injury to the chest, including the ribs, heart, and lungs, such as heavy blow. And lastly, number 7, burns. Burns are tissue damage that results from heat, overexposure to the sun, or other radiation or chemical or electrical contact.
Sepsis, a serious widespread infection of the bloodstream or the body's extreme response to an infection. It is a life-threatening medical emergency. Blood transfusion, the intravenous introduction of blood products into one's circulation. Inflammation of the pancreas, or also called pancreatitis. What happens is that the digesting enzymes it produces might cause tissue damage and can injure the kidneys, lungs, and as well as the heart. Drug and alcohol overdose, or too much consumption of drug and alcohol. Lung and bone marrow transplant. This is a medical procedure that involves the transplantation of healthy stem cells into the bone marrow or the bloodstream and also restores the body's ability to produce red blood cells, white blood cells, and platelets. Infection. Common type of infection that induces the occurrence of ARDS is sepsis. Environment. It includes being exposed to an air pollution for weeks or months, and as well as being exposed to a cigarette smoke.
Lifestyle habits. This includes heavy alcohol use, overdose of illegal drugs, and smoking. Medical conditions or procedures, such as pneumonia, acute pancreatitis, and blood transfusion, to name a few.
Medical history. The doctor may inquire about any medical issues or recent occurrences that could be considered as a risk factor in the diagnosis of acute respiratory distress syndrome or ARDS. Physical exam. This is done to examine if there are signs of ARDS such as abnormal breath sounds, fast heart rate, bluish skin, swelling, and such. Imaging tests such as a chest x-ray. A chest x-ray can reveal which sections of the lungs and how much of the lungs have fluid in them, and as well as whether or not your heart is damaged.
Laboratory tests. Oxygen level may be measured using blood from an artery in the wrists. Other blood tests might be used to look for evidence of infection or anemia. If lung infection is suspected, secretions from your airway may be tested to determine the cause of the infection. Heart tests. Because the signs and symptoms of acute respiratory distress syndrome are similar to those of certain heart problems, your doctor may recommend heart tests such as electrocardiogram and echocardiogram.
The first goal in treating ARDS is to improve the level of oxygen in the blood, since without oxygen, your organs cannot function properly. Oxygen breathing support. To raise oxygen levels in the blood, which can be given through tubes resting on the nose, a face mask, or tube placed in the windpipe, or machine to support breathing. This includes non-invasive ventilation. This is to help keep airways open by blowing air through a face mask. We also have ventilator. This will be adjusted by the physician to prevent any damage to the lung tissue.
There are different medications given to patients with acute respiratory distress syndrome. This includes, number 1 is antibiotics. This is given to treat infection. Next is anti-inflammatory drugs such as corticosteroids. This is given to reduce inflammation in the lungs in the late phase of acute respiratory distress syndrome, or sometimes if the person is in septic shock. Next is diuretics. This is to eliminate fluid from the lungs. Next is bronchodilators. This medication is given to open up the airways. Next is anti-anxiety drugs. This medication is given to relieve the anxiety of the patient. And lastly is muscle relaxants. This medication is given to help prevent coughing or gagging while on the ventilator, or to reduce the amount of oxygen your body needs.
Other managements, we have physical therapy, fluid management, lifestyle modification, and nutritional support.
Closely monitoring in the intensive care unit. Regularly monitoring patients by checking on them and their health while they are in the hospital and acting if they exhibit indications of deterioration can help prevent serious complications, especially in the intensive care unit. Frequent assessment of the patient's status is necessary. Assessments are frequently repeated throughout a patient's hospitalization to assist staff in evaluating the patient's progress and predicting or preventing any upcoming complications. Position or frequently turning of the patient. A patient's posture in bed should be changed every 2 hours to keep blood flowing. This keeps the skin healthy and keeps bed sores away. When turning a patient, look for redness and lesions on the skin. Restrict fluid intake as prescribed. This is to minimize hydrostatic pressures to the greatest extent possible. This can also aid in maintaining a proper fluid balance. Fluid buildup in the lungs can be caused by too much fluid in the body. Too little fluid, on the other hand, might put strain on the organs and the heart.
Explain procedures and provide care in a calm, reassuring manner. In this way, it can alleviate the anxiety of the patient and as well as to assure the patient that he or she understands the procedure and as well as the rationale behind it. Assess for problems with ventilation that may be causing the anxiety reaction. Shortness of breath, fast breathing, or chest tightness should be observed. Provide nutritional support for the patient. This is to make sure that the patient is still getting the appropriate nutrition that he or she needs in order to keep his or her condition in control. Monitor blood chemistry and fluid levels. Since ARDS is caused by the leakage of fluid from tiny pulmonary arteries into the lung air sacs, or what we call alveoli, oxygen levels in the blood diminish when the protective membrane between blood vessels and air sacs is damaged. Monitor other body systems. ARDS is caused by an accumulation of fluid in the air sacs. Less oxygen reaches the bloodstream, depriving other organs of the oxygen they require to operate. As a result, a multi-organ degeneration is possible. Prevent pressure injury and ventilator infections. Preventing pressure injury can hinder the patient from developing skin injury or skin damage. Ventilator infections can be fatal and must be monitored since it can further complicate and can cause more infection to the patient.